I try to communicate with the patient maybe about 30 minutes, even if it's possible, maybe 40 minutes, just call the patient, because sometimes we might not be able to get a hold of them right away. So it can be a little challenging. So I always try to give them a call before their appointment time to get them all scheduled, get them checked in, and get them ready for the appointment. We'll ask the patient if there's someone else to assist. If we're able to send it by email, we can do that. Sometimes we'll try our best to see if we can help them as much as we can. If that can't be possible, I think the next option is having the patient come in and try to get them scheduled to come into the appointment. We ask them what's the means of their transportation, if there's any issues. If there is, we notify the provider or notify the social worker if the provider is kind of busy. But normally we will notify the provider, and then they will figure something, see means of transportation for the patient.
There's different things we can do. We can reset and talk with the patient about if there's issues with their Wi-Fi necessarily, or sometimes if they're connecting from their phone, it might have something that they have to adjust the volume. The other thing that happens also, if they're connected to the phone, if they have other apps going on, they might be interfering with the sound, or if they have music in the background, it will interfere. In those cases, we ask them to kind of reset, and we have the link already open, so we might say, hey, what about log out and log back in? Will be here to see if that helps. So especially if they're using from the phone or a different Wi-Fi. If they're using from the computer, then we might have to say maybe reset again, maybe make sure that you don't have anything else attached to the computer that is affecting the sound. If worst case scenario, if like I said, there's no way of the sound happen, we could potentially also, as long as we have them in the video, we can also let them know, okay, I'm also going to give you a phone call, stay on the video, and I'm going to talk to you on the phone. So that way we're talking with them on the phone while we're seeing them on the video.
From a resident standpoint, it's pretty straightforward because our medical assistants or nurses just send us a link, just like they do for the patients, and we click on it. We get connected with the patient and can just start the visit right away. Briefly, we have to review, make sure that they are in the state of Indiana, not driving, and they're in a safe environment, an okay environment to speak. One thing that I really like is that this really does help get patients connected in our office if they are not able to come in person. And I also like that our staff is on the line listening to the visit throughout the whole encounter. So they can be listening live and provide us some feedback on the visit and help us with management in a more seamless way because they are actively watching and present. And so I really enjoy it for those reasons.
Yeah, so when the drop off, and because there's problems with connection, then that's kind of the things where we have to talk with our social worker. What are some of the barriers the patient has in order to come in person? Because if we were unable to connect with them in some way, and there's some things that we could have conversation over the phone, but doesn't really include the whole aspect of the exam and figure out what's happening with the patient. Also, there's issues with insurance and billing that affects just having a phone versus having a face-to-face virtual visit. So if there's issues with connectivity, then we'll have to find ways. If the problem is transportation, is it the problem is the hours where the patient's available to get the appointment, or the person that needs to connect, and we'll have to figure things out that way to continue to provide best care as possible in a way that is not only effective but is safe for the patient as well.
I think telemedicine will always be around. I think any way that we can connect with patients better to provide them care is a step forward and a move in the right direction.
The pandemic has created a more open access also in understanding about the opportunities that are in virtual visits and also with telemedicine. And this has also created an opportunity for quick visit that sometimes don't require to have a follow-up that needs to be in person, which we can understand can affect the patient's workflow, family environments, especially with things that are minor, like follow up with the medication, especially when it comes to primary care, or follow up with small little things that can be easily being targeted and it won't affect the flow of the life of the person having to come into the office, spend the whole day, versus we can just do it very quickly in a 15-minute visit through the phone. So patients actually are enjoying it. It's one of the things that we actually have to find a ways to actually let them know, well, this is appropriate to have in person. However, these are all the things that we have to have you see it in person. person. But patients are enjoying virtual visits, so I don't think, again, it's something that's going to go away.